Hello, dear friends, I'm here with you. Sofya Dorinskaya, psychiatrist and head of the Sofya Dorinskaya Center for Medical Information. Today I want to talk to you to tell some and remind others about a hypo and avitaminosis condition known as scurvy. By the way, ascorbic acid or vitamin C is actually named after it, and this is a negation. Scorbut means anti-scorbutic, meaning a substance that treats scurvy, that very condition. And as I understand it, most people nowadays, including doctors, consider the main sign of scurvy to be that so-called scurvy gingivitis, or the inflammation of the gums, which anyone can look up on the internet. And in fact, I got the impression that this is where the diagnosis of scurvy ends, but in reality, scurvy is a very serious and very dangerous disease or condition. Actually, the primary and most significant clinical sign of scurvy is not just simple gum inflammation or even bleeding gums. It is actually widespread internal hemorrhage or spontaneous bleeding throughout the body. The course of scurvy is generally divided into two stages. The first is the latent or hidden stage, and the next is the stage of overt vitamin deficiency. Let's take a look at the symptoms a person has during the latent stage of scurvy. These include malaise, decreased work capacity, rapid fatigue, and loss of appetite. Sometimes a person experiences pain in the muscles or large joints. For example, a person may complain that their calf muscles hurt if their job involves physical exertion. They walk a lot or their work requires them to be on their feet. Patients often complain of shortness of breath and heart palpitations even with minimal physical activity. Naturally, when doctors send them for examinations, nothing is found. The lungs are clear, the heart is fine. And this lack of characteristic symptoms in the latent stage of scurvy leads doctors to often overlook this condition, frequently diagnosing neurasthenia, or as is common now, depression. Doctors suspect patients have some kind of chronic hidden infections and may even start prescribing antibiotics, possibly as a preventive measure. Doctors suspect anemia in patients because the person has a pale complexion, which is directly related to a decrease. It's as if there's less hemoglobin in the red blood cells, and when you look at the person, they're pale, so you start thinking they might have some kind of anemia, but when you check, you usually don't find anything significant. And so even old doctors in the mid-20th century wrote that the idea that a patient might have a latent stage of scurvy doesn't even occur to the physician and may only come to mind if there is, so to speak, an epidemic outbreak of scurvy in the region. But considering that nowadays this kind of diagnosis is not performed at all, I think that for several decades now, the diagnosis of latent stage scurvy hasn't been made at all. In other words, it goes unrecognized. So, the next sign to look for is a noticeable paleness or pallor of the skin, as well as a distinct yellowish-brown discoloration of the surface. This can make scurvy appear remarkably similar to cases of suspected adrenal gland pathology. But we must not forget that vitamin C in humans is stored in the endocrine glands, in the adrenal glands, in the pituitary gland, in the intestinal wall, and that vitamin C is also consumed during the release of adrenaline. And so we see an overlap of symptoms, an overlap of external signs such as yellow-brownish, slight skin discoloration, while at the same time the skin itself appears pale. The next sign. The skin over the fine hairs, these vellus hairs, appears to be slightly raised. And later on, at the base of these hairs, doctors observe hemorrhages. But as a rule, even this symptom is overlooked. After this stage, this hypovitaminosis, I should say, can last for a very long time, even for years. Nowadays, this can actually be stretched out, I understand, literally for decades because vitamin C is available and people can one way or another buy oranges or go and have a glass of freshly squeezed orange juice. For a while, yes, a person can buy fresh bell peppers, sweet ones, in the supermarket all year round. And that's why these symptoms, this condition, can drag on for a very long time. If hypovitaminosis C progresses to a clear case of avitaminosis, then hemorrhages start to play the main role. They can occur under the periosteum, in the subcutaneous fat, in the muscles. They can occur there. And by the way, they can also happen in internal organs. Recently, there was a discussion of a clinical case on the Doctor at Work website, and so my attention was caught by a comment from a doctor. As a sort of joke, or maybe a bit of sarcasm, if you can call it that, she wrote, "Well, yes, of course, there are a few red blood cells in the urine per field of view." They were talking about something there? My friends, a few red blood cells in the urine per field of view appearing periodically. This is a sign of scurvy. This is that very hemorrhage, that very destruction of capillaries. And when there are indeed only a few red blood cells per field of view appearing in the urine, you detect them, then they disappear, and then they may appear again. Just a few, meaning it's not a massive hemorrhage. Why? Because the hemorrhage in scurvy, it happens, the first one starts to resolve, and when the first one is already beginning to heal, a second hemorrhage begins. So, ladies and gentlemen, if your patient has a few red blood cells in their urine under the microscope appearing periodically, you should stay alert. This could be scurvy. When a person experiences hemorrhaging in large joints, for example, their gait changes, what's called a tightrope walk or an elderly person's gait. In other words, it becomes very difficult for them to walk. Very often, one particularly common comorbid disease that is often seen secondary to scurvy is tuberculosis. And when there is a significant pleural effusion present in a case of tuberculosis, and this specific effusion is found to be hemorrhagic in nature, then the hemorrhage itself may actually be that very same bleeding we are discussing. You should always keep in mind that the underlying cause, the foundation, the background of tuberculosis, especially tuberculosis that does not heal within the expected time frame and is resistant to therapy, is severe vitamin C deficiency, that is scurvy. As our teachers point out, the clinical presentation of this secondary disease, it can completely mask the symptoms of vitamin deficiency, but how can you check when you are treating a patient? Vitamin C has such a beneficial effect on the course and cure of tuberculosis that it is depleted very quickly. Scorbutic gingivitis is one of the least indicative symptoms, if we can even call them symptoms, because often scorbutic gingivitis, that very redness of the gums, it may only present as slight gum bleeding and a mild enlargement of the papillae, the gum tissue between the teeth. That's it, it may end right there. Of course not. If you already see fully developed scorbutic gingivitis, that is, scorbutic inflammation of the gums, then of course the clinical picture is pronounced. Very often, there is that same anemia, hypochromic, hypo meaning decreased, chromos meaning color. Yes, when there is not enough hemoglobin in the red blood cells. And we see a pale person, when you look directly, you see the paleness. Yes, this is a very common sign. Scurvy fever. A fever that appears for no apparent reason. When you examine the person, they have no signs of inflammation, so you start thinking about some kind of chronic inflammation, but you find nothing. When you give the person vitamin C, that is anti-scurvy treatment, the fever goes away. This is associated with a disruption of the thermoregulatory center. It should be noted that signs of exhaustion are not mandatory in scurvy, because scurvy is a specific deficiency. It does not depend at all on the caloric content of food, so a person may have normal nutrition or even excessive nutrition. Because one of the signs of scurvy deficiency can actually be excess weight, and as for complications that we may have with scurvy, these are of course tuberculosis, which I mentioned, and frequent colds. Here we need to know about the pathogenesis or the mechanism of development, the pathological cycle that develops in scurvy. When a person falls ill with either an acute or chronic inflammatory disease, naturally, resources are spent to resolve this situation. Why vitamin C? Because vitamin C increases the bactericidal properties of the blood. So we have a person who is either suffering from a prolonged illness or has suddenly fallen ill, and they consequently, as a result of this process, a vitamin C deficiency begins to develop. And with a significant deficiency of vitamin C, the bactericidal properties of the blood decrease. And once again, some kind of secondary infection joins in and complicates things. And here our teachers point out that the presence of scurvy, the presence of hypo or avitaminosis C may not be visible to the doctor, but he must know that it exists, understanding the pathogenesis of scurvy. This is one of the pathogenesis, how scurvy develops. It was precisely this that our teachers associated with seasonal inflammatory diseases. In the spring, specifically influenza, tuberculosis, pneumonia, acute respiratory diseases are all linked to the fact that in spring the amount of vitamin C in the human body physiologically decreases. The bactericidal properties of the blood drop, and thus a person. People start getting sick more often. Therefore, in all these situations, knowing the pathogenesis of scurvy, the doctor should include the anti-scorbutic vitamin or vitamin C in their treatment regimens. As you can see, the clinical picture of vitamin C deficiency is sparse. Very often, as I have already mentioned, it is masked by secondary diseases, or it gets lost against the background of other hypovitaminoses, for example, vitamin A deficiency, which very often occurs together with it, avitaminosis A and vitamin C deficiency. I believe that my presentation today was very useful. Those who didn't know have learned. Those who had forgotten have remembered. I urge my colleagues to be more vigilant regarding scurvy, both its latent form and its fully developed form, to all my viewers. Since it is spring now, I urge you to take a course of vitamin C, especially if you have lingering illnesses, chronic inflammatory diseases, or if you have acute illnesses. You should include vitamin C in your treatment regimens. As I already mentioned, vitamin C is consumed when adrenaline is released. Therefore, if you experience stressful situations in your life, in order to prevent hypo and avitaminosis of vitamin C, you must be sure to include vitamin C in your diet. And you must ensure that this is absolutely one of the most significant and serious matters we face. Avitaminosis-related pathologies, which, as a foundation or cushion, serves as the basis for other serious diseases. And if this foundation, this base is not treated or addressed, recovery will be practically impossible, as is the case, for example, with tuberculosis. I hope this video was clear. I hope you have gained more knowledge about how to stay healthy and how to protect your body. And of course, I wish you good health. This was Sofya Dorinskaya with you. All the best. Goodbye.